Good morning, everyone. I'm Dr. Amritha E Pady, Assistant Professor, SKM CHRC, Department of Kaya Chikitsa. Today, I'm going to present the topic called Epigenetic Modification Associated with Childhood Trauma. It's a meta-analysis and the role of medhyarasayana and personalized nutrition mindfulness in epigenetic reversal. So I'm straight coming towards to the introduction. So childhood trauma is a global mental health concern and it has lasting impacts on brain development and is recognized as a key contributor to the onset of neuropsychiatric disorder later in life. So emerging insights from epigenetic research indicate that mechanisms such as DNA methylation, histone alteration, as well as regulations by non-coding RNAs are closely linked to the enduring consequences of early life adversity. So, among patients in remission from psychiatric illness, most of the patients have one form of, at least one form of psychiatric or one form of childhood trauma in the psychiatric disorder. So, emotional abuse most prevalent, followed by physical abuse and emotional neglect are the some of the etiological factors observed. So, epigenetics is the study of heritable and stable changes in gene expression occur through the changes in the chromosome rather than in the DNA sequence. So it happens through two mechanisms. That is, one is regulate the gene expression through chemical alteration of DNA bases, and second one changes to the chromosomal structure in which DNA is packaged. And understanding the epigenetic mechanism through three ways. That is, one is the process through DNA methylation, second one through the histone protein modification through chemical alteration, and the third one is through non-coding RNA associated gene silencing. It is still in a research process, and much of the conclusion factor is not happened in this particular third category. And what is DNA methylation? So DNA methylation involves the attachment of the methyl group to the cytosine base, specifically within the CpG dinucleotides. So these CpG sites often cluster together to form CpG islands, which are frequently located in gene promoter regions and a typical site for the epigenetic modification. So when cytosines in these regions become methylated, they attract repressive proteins that hinder the binding of transcription factors, thereby limiting the gene expression. So additionally, this methylation promotes the formation of tightly packed chromatin or heterochromatin, which further restricts the access of the transcriptional machinery to the DNA. So as a result, what happens? The methylation within the promoter regions commonly leads to gene silencing. The second one, that is histone modification, actually happens it happens through and catalyzed by specific enzymes. So that happens through the process such as acetylation, methylation, phosphorylation, and ubiquitylation. That means the addition of the acetyl group, addition of the methyl group, and the addition of phosphoryl group, and addition of the ubiquit proteins. So these all can alter the interactions between DNA and histones within the nucleosome structure. So here are some alterations, chemical alteration through acetylation, methylation, etc., and which having the effects on the gene expression and what are the results. So you can see some examples I have quoted here through by referring some of the articles. So here acetylation of lysine 9, lysine 27, it gives the gene transcription activation. In the same way, methylation on the histone lysine 4 group as well as histone lysine 27 group, which gives gene activation as well as gene silencing. So in such a way, depends upon the which group, which histone it is getting combined with which type of lysine, methylation or acetylation or phosphorylation, the type of the results varies here. So in the same way, the impact on childhood trauma on epigenetics. So what is happening there? That is adverse events during childhood such as emotional, physical and sexual abuse can severely hinder both psychological and physical development. So according to the data from 2015, so approximately 1 billion children and adolescents globally are exposed to violence. So early life maltreatment is a substantial contributor to public health concern, accounting for nearly 45% of childhood disorders and 25 to 32% of psychiatric condition manifesting in adulthood. So individuals who experience early adversity have a heightened risk for developing mental health disorders such as depression, PTSD, schizophrenia, etc. So growing evidence indicates that stress during the early postnatal period induce long-lasting epigenetic alteration in these sensitive brain regions, that is prefrontal and amygdala and hippocampus. These regions definitely have an impact of this particular trauma, and it dysregulates neuroendocrine and immune pathways well into the adulthood. So these include modification to DNA methylation, histone proteins, along with shifts in non-coding RNA activity, so particularly microRNAs. So one of the most studied biological system in this context is the hypothalamic pituitary adrenal axis disturbances, which plays a central role in managing stress responses. So role of NR3C1 gene and FKB5 gene in childhood trauma. So it is a glucocorticoid receptor gene, that is NR3C1, as well as FKB5 is a chaperone protein, interacts with the glucocorticoid receptor and negatively regulate the activity of glucocorticoid. So ELA like child abuse, that is early life adversity like child abuse, can lead to hypermethylation in NR3C1 gene as well as hypomethylation in FKB5 gene, that is the chain of exon 1F and as well as in intron 7. This methylation activity is particularly observed. So it is having the reverse activities. So this is what the epigenetic effects which happens in the childhood, that is early trauma exposure definitely have the its effect on altering the epigenetic, that is altering the genetic modulation, that is it gives a alteration in the epigenetics negatively as well as positively. So well parenting and child is exposed to very good parenting and very good environment and very good societal acceptance, the child will have definitely positive alterations in the epigenetics, and it can also impact as a negative if the child is exposed too much into the abuse or trauma, mental trauma, etc. So this is what through the meta-analysis gives the result as the NR3C1 exon 1F higher methylation, higher DNA methylation process is seen, and FKB5 intron 7 decrease in methylation is observed. So this comes coming into the straight into Ayurvedic references on medhyarasayana. What is medhyarasayana? That is the drugs which improve the functioning of the brain through by promoting intelligence and activity of the improving the neural plasticity. So these are the research studies which indicate that it is having this impact on the brain development. So Manduka Parni, Bacopa moneri, it is used Swarasa. Swarasa means we will be squeezing it and taking the liquid or the that will be taken inside. So Yeshti Madhu is used as the churna, that is in the powder form with by adding with the milk. And Guduchi is the in form of Swarasa we are taking. And Shangapushpi is the best among these four, and it is used as the Kalka. And these are the Nitya Sevaniya Dravyas, that is, it is taken. Shashtikashali is the rice, red rice, Yava is the barley, Mudga is the pulses, green gram pulses, and Saindava is the salt, and Amlaki is the gooseberry, and Andarikshajala is the rainwater, and Gogrida, cow's ghee, Godugdha, cow's milk, Mathu, Jangala Mamsa, meat of the animals. These all should be taken daily to balance the diet, and one should get the nutrients balancely through this particular dravyas. That is what it is indicated by our acharya. So epigenetic reversal through the aim is reduce the hypermethylation in NR3C1 gene expression as well as increase the methylation in FKB5 gene expression. So medhyarasayana such as Shankapushpi, the study suggests that it is an anxiolytic, that is anti-anxiety drug, and also neuroprotective and antioxidant, analgesic, immunomodulatory, antimicrobial, anti-diabetic, and cardioprotective activities. So a diet rich in methylation nutrients like folate, choline, and betaine can improve the FKB5 methylation, as well as these nutrients in foods like eggs, legume, leafy greens support the methylation process, which can affect the FKB5 expression and stress response. So industrialized junk food will alter the metabolism, such as high blood sugar, as hypertension, and HDL, LDL levels. That is, it can even increase the BMI, etc. Can give inflammatory changes in gut microbiota, which can give negative impact on the brain activities. These findings allow us to suggest that the food can be regarded as a stressor agent capable of altering the epigenetics of the stress response, taking into account socio-economic, psychosocial, and metabolic confounding factors. So scope of the research are the combination therapy such as medhyarasayana along with nutrition planning and mindfulness techniques, and definitely good parenting and avoiding the trauma to the in from childhood stage, and aims for a epigenetic reversal, holistic mental health care, preventive psychiatric approach, and required a epigenetic analysis targeting the methylation status on gene expression. So I'm concluding with childhood trauma is having a lasting epigenetic impact, and Ayurvedic strategies may offer reversal potential, medhyarasayana, mindfulness, nutrition, complementary epigenetic tools, and calls for interdisciplinary research and integration into care models. Thank you.